I want to move on from what has been said already. It's sort of created a good basis for what I want to talk about. And I want to talk a little bit about what might a healthy, sustainable diet look like. I don't think we know exactly yet, but we're starting to sort of see how can we move forward and where we need to go with this. And one of the big things is how do we draw together all these different aspects of a sustainable diet? I was thinking somebody before me might have actually given the FAO definition of a sustainable diet, which has multiple aspects to it. It's health, environment, it's equality, it's people, etc. And just really one of the challenges we've got is how do we draw all this together? Because in science we traditionally take a very reductionist approach to things and we narrow down on what we're going to study. And actually for this, what we need to do is step back and look at the whole picture. And if I can use this piece of cake to try and describe what I'm talking about, in nutrition, we think about nutrients. We're very up close to it. It's all about health. It's about fat. It's about sugar. It's about protein. And so what we do, if we're standing looking at this food system, which is our slice of cake today, is we just see that back end of the cake because we're so focused on nutrition and health. From an environmental perspective, when we look at the food system, we tend to think about commodities. We're talking about livestock, we're talking about cows, we're talking about wheat, and there are multiple layers within that. So it might be greenhouse gas emissions, it might be water, land use, biodiversity, etc. But again, we're just looking at this one slice of the cake. And what we're not talking about quite so much at the moment, and I think is where we need to go, is people and society. People don't eat nutrients. People don't eat cows. They eat meals, they eat snacks. They eat lasagna, they eat cake, these sorts of things. And I think this is where, in the modelling, we need to go forward to actually start thinking about people. But what I want to do, first of all, is talk about the project Tim's just mentioned, which was called Live Well. This was a project that was commissioned by the WWF. And the question was very simple. Is it possible to have a diet that would meet all nutrient requirements for health and reduce greenhouse gas emissions? So it was a very practical thing to just say, is it possible to do this? Step one. So the brief was really looking at our dietary requirements for health, which you can see here. The ones in red are the ones we have maximum limits for, so we shouldn't have any more fat, saturated fat, sugar and salt. The ones in green are the things that we have minimum requirements for, so these are your carbohydrates, protein, your, vitamins, minerals, etc. We also have requirements for food, so everyone's aware of the 5 a day. We have a minimum requirement for fish in terms of health. And we have maximum recommendations for red meat and processed meats. So what we're trying to do is come up with some sort of diet that would meet all these requirements, but also would have a reduction in greenhouse gas emissions. So we did this by using mathematical modelling, using a list of about 113 foods, and said, how do we achieve this combination of meeting our dietary requirements and meeting greenhouse gas emission reductions? Well, we ran it through the model, and actually you can achieve about a 90% reduction in greenhouse gas emissions, meet all your dietary requirements, which would be a huge sort of impact on reducing our carbon footprint, etc. The only problem was it only came up with 7 foods. You had to eat a lot of brown flakes, a lot of spaghetti, some peas, a little bit of onion, and actually let you have a bit of chocolate. This is where we come back to people in society. If we came out and said, okay, this is what a healthy, sustainable diet is. By the way, you can't have milk on your brown flakes, you've got to have water. It's not going to be desperately acceptable, so we have to look back. So we went back and said, okay, what do we need to do? We added what we loosely called acceptability constraints. We said, if you're going to have that much brown flake, well, you wouldn't ask someone to eat 7 bowls of brown flakes every day. We'll limit it to 1. If you're going to have brown flakes, we're going to put milk in it. And what you end up is a compromise. We only got a 25% reduction in greenhouse gas emissions, but what you can see from the diagram here is you've got a much wider range of foods that you can consume. And also the important thing from this was it wasn't just about reducing one type of food or changing one type of food, it's rebalancing the whole diet. So you can see that yes, meat went down, also high-fat sugar foods went down, cereals went up, fruit and vegetables went up. Dairy didn't change a lot. Now, that was part of the acceptability constraints. If we were asking people to have cereal, we could have gone for non-dairy options. But again, very few people actually consume these. We were wanting something people could relate to and start making steps with this. The other important thing to take away from this was one of the things people said, so if it's a healthy diet, it will be a lower greenhouse gas emission diet. Not necessarily. This diagram's just basically showing down the right-hand side of meeting your dietary requirements, reducing greenhouse gas emissions. Anything in green is you're achieving this, anything in red you're not. And all this is showing is actually you can have a healthy diet that meets all greenhouse gas emissions, meets all your dietary requirements, but you can double your greenhouse gas emissions. Pick the right foods. And equally, you want a very low emission diet, add lots of sugar. So you can end up with a very unhealthy diet, but with lower emissions. And obviously, you can model an unhealthy, high greenhouse gas emission diet. So you can sort of get any combination of these that you want. So we can't go away thinking, well, if we eat a healthy diet, it will automatically be one that's more environmentally sustainable. So just moving on slightly, we've been able to model what I refer to as idealistic diets. Yes, we've only looked at greenhouse gas emissions. We can add water, we can add all sorts of other variables into these models and come up with scenarios. But what I believe is missing is people. And actually, if we're not going to start thinking about people and society and how do we start bringing these into the model, the paper that Tim referred to, where it said we need, the whole food system could be a 2-degree, account for the 2-degree change in global warming. One of the conclusions they came to, and I know a couple of the authors, they said that actually what we need to do is reduce beef consumption, which is a relatively easy task. I sort of worked in nutrition for 25 years, and I would challenge changing any dietary behaviour as a relatively easy task. So I think we need to start thinking about why people eat and add this in. This is taking Tara's slide. We've seen that the whole debate around this tends to focus on meat and livestock. There are positive nutritional benefits for this. There are a lot of negative environmental issues. But will people eat less meat? Sue Dibb is going to speak this afternoon about a report that came out last week, which was asking, are people willing to eat less meat? And about a third of people said they were willing to consider eating less meat. We've done work, and actually the numbers are a lot smaller than that of people who say they're willing to eat less meat. So we need to explore why and how can we get around sort of some of these issues, because I think if we don't start looking at some of these issues about people, society, why do people eat, we'll keep coming up with ideal diets, but actually won't move forward. People eat because of taste, pleasure, tradition, culture, identity, all these things. These are, if you think of a menu, next time you're in a restaurant, if you look at the hierarchy of foods on a menu, it'll be steak, other red meat, chicken, fish, and veggie option. It doesn't even tell you what it is. Why can't the veggie option be at the top? Would that start to shift some social norms? It doesn't, you know, these are all enforcing what we think about the foods that have a higher status in society. The Sunday roast is still actually one of the most popular meals in Britain. In terms of identity, this quote came from an Australian paper where they were asking people to eat less meat. One of the comments was, I don't want people to think I'm strange or a hippie. How do we get away from this perception of people have this as an issue? Another study that was done in Newcastle, looking at healthy eating among secondary school children, and they concluded healthy eating is bad for young people's health. It's socially risky. If you're the one who turns up at school with a Tupperware box with couscous, etc. in it, or if everyone else is having chips, you feel socially excluded. We laugh about this, but actually most of society want to feel included. This was a quote from a study in Canada, where they asked children to describe characters and put characters to different foods, and this is their boys' description of meat. It's outgoing, it's popular, it's physically impressive and attractive to girls. So these are the sorts of things. Broccoli was the one, the kid that sat in the corner, nobody really wanted to talk to, and everyone felt a bit sorry for. But these are really interesting ways to see about how we think about food, and we need to start thinking about how do we start bringing this into the discussion. So just really to sort of end on lessons we can learn. I've worked in public health nutrition, I've worked in obesity, and I think we can say we've monumentally failed at changing behaviour. If you look at the prevalence and the trajectory of obesity, we've not been successful. So before we start going down doing the same sorts of things, what can we learn and do slightly differently? Let's recognise that the social, personal experience of eating is actually really important, and actually probably to most people more important than health and environment. Changing dietary habits isn't going to be easy. Education alone is unlikely to change behaviour. We've known that. There's plenty of evidence for that. And also this, if we don't stop taking this reductionist view, which, back to my piece of cake, we're going to end up with unintended consequences. We need realistic, sustainable diets, not idealistic, sustainable diets. And who needs to change? It's not just people who need to change their diet. We need to change over the whole system. We need action from government, industry, and society. And just to give you one final slide on, people said to us in some work we did, if you have a food scare, that will do it. People will change their behaviour. This is some data from Kantar World Panel that looked at the sale of frozen beef burgers after the horse meat scandal. So you can see here, January 2013, all over the news, horse meat scandal. People stopped buying burgers. In July, the sun came out. What do you put on a barbecue? Sales went back to normal. So we sort of say, oh, if we have a food scare or something like that, it will change behaviour. It's very short-lived. So if I can finish there, just the message is we need to think about people.